Good evening, everyone. My name is Nancy Ferguson Brown, and I'm a dental hygienist, and I'm from Morganton, Burke County. My husband and I drove to Charlotte today to be a part of this event. Glad to be here. I have just a few things I want to discuss this evening. I really don't have anything written and prepared. Most of this is just off the cuff. As a dental hygienist, I'm in public health. I am a state employee with 30 years of service to the state of North Carolina and to Burke County. I'm concerned about the cuts in the state budget, and in particular the Health and Human Services Division. I'm here primarily to advocate for the North Carolina Oral Health Section, my employer. In the House budget, it has been totally eliminated. However, I'm very glad to say that I have just received word that it has now been written back into the budget. So therefore, I'm here to say thank you. This is a program with 90 years of service to the citizens of North Carolina, to some of our most vulnerable citizens, our children. And so I'm greatly thankful that the program is back and it's not eliminated. We will, of course, take some cuts, but to totally eliminate a program that has been functioning and working for so many years, it just breaks my heart, especially being a part of it and know what can be achieved through these public health programs. I'm concerned also about this budget because it hurts children, but working families as well. I work in a local health department. I work with the rich, the middle, and the poor. So I can feel the pain from all levels. I'm also interested in the cuts to the Medicaid program and to the North Carolina Health Choice. We need these programs. It's the only way some people can get health care, even adults and particularly our children. I've spoken with many parents on the phone and know how they struggle, and particularly the health choice are for people that are not deadbeats. They're working people, and they just need a little bit more. They just need a hand up. They're struggling. I'm also here to speak about the Healthy Carolinians initiative. Many of you perhaps don't know about that. It's a very small part of state government, but it does a lot in our communities to bring people together to advocate for health on a local basis. And Healthy Carolinians, it works. I've been a part of it in Burke County, and we're making progress. I'm also very interested in the North Carolina School for the Deaf. Being from Morganton, it's a very critical program and a great facility that served our community for decades. I understand the school is small, but I encourage our legislative people to take a look at it, and perhaps we can use the facilities, the property more wisely, and form a task force or something to advocate for these students. Many of them are not only deaf, but they're multiply impaired. But they're good citizens, can move our economy along, and I'm advocating for our deaf schools. And lastly, we've been talking about raising revenue, and nobody wants to be taxed. I don't. But I'd like to encourage our legislative people to tax luxuries, cigarettes, and tobacco. I know that there's been a lot of controversy about our lottery, but I just know that with raising revenue on those two items can really bring about a lot of good in our state, and also greatly reduce health care costs, which are, as you know, just astronomical. And on a light note, I like Susie Orman. I think she's got a lot of guts. And if you've ever listened to her, she says, people first. money second and things last. So I encourage our state legislative people to think about it and put people first. Thank you. I enjoyed being here.